Okay, well, thank you both for joining us today. From my perspective, we've been writing a lot here at Dentistry about accessibility in dentistry and how this can be improved and why it's so important. And obviously, this is something that is of value to both of you as well. So I think a good place to start is what prompted this partnership? Why have you both? Well, why has Oral-B and the IDAH come together?
Yeah, maybe I can start on this one. First of all, the issue is at scale for Europe. I mean, we know that approximately 166 million of people in Europe are affected by a disability. So it is something. And we know that a third of those experience gum issues due to struggles with maintaining their oral health. So that's, let's say, the starting point for us. Then on the Oral-B side, for 70 years, the Oral-B brand mission has been to get adults and children alike to achieve healthier teeth and gums at home or at the dentist. That's our mission. And we recognize actually our immense responsibility to drive change and the opportunity we have if we make both our business and products more accessible to everyone. So as we embark on our journey, we'll continue to work with professionals, we always do, and consumers, to better understand where and how we can help to improve oral health outcomes for everyone. But of course, we need to learn. And we come also with a lot of humility, and we see IDH as really bringing expertise, knowledge, much better insights to really move forward and accelerate. That's really what we are after.
Yeah, I think, hello. Yeah, IADH is an international organisation with about 8,000 members, and they're not just dentists, they're dentists and allied health professionals, so they may include speech and language therapists, hygienists, nurses, anaesthesiologists, everybody interested in disability and oral health. And our mission is to actually address oral health inequalities, because we know that oral health in people with disabilities is inequitable wherever people live in the world, including the UK. And I think the sad thing that we see is even when people with disabilities have dental treatment, their outcomes are lesser. They have more extractions, so they end up with more missing teeth. So I think there are two things that, and so for somebody with disability, wearing a denture is going to be harder, even putting it in and out. So I think that at base, we need to make sure that people with disabilities have higher expectations of what should be happening with their mouths. And I think that dentists should have higher expectations of what is expected to give people equitable outcomes. Dentistry has come such a long way. We have the technology now to be able to do dental treatment, minimally invasive, all of this thing. But the key is that we need to get prevention happening. We need to have people putting toothpaste on their teeth twice a day with a toothbrush. And for many people, that's a struggle. They need a personalized education from their healthcare professional to help them do that effectively. And I think that's our mission and that's our aim. And so we realized that Oral-B had the same mission and the same goals to make oral health universally acceptable to everyone. And so it made a natural fit for a partnership, really.
Yeah, absolutely. I think you've touched on some points there that have become particularly relevant over the last couple of years as well, with the onset of COVID and now kind of dealing with the aftermath of that. There's a lot of patients who are struggling to access dentistry in the UK, and I can imagine that's even harder for those living with a disability as well.
Correct.
I mean, this might sound like quite an obvious question, but I mean, why is accessibility so important in dentistry? Because I think a lot of the people listening might have a very sort of an overview of why it's important, but might not really understand why it is so integral to delivering the right care to the right people. So why is it so important to your profession?
So we are talking a large number of people. We are talking very diverse population with different needs. And we are, let's say, talking lack of education on many fronts. And starting by, let's say, us sometimes. And that's why we want to partner even more with experts. And also continuing with dentist professionals, requiring, from school down to, let's say, the one practicing today, better education and probably appropriate messages. So that's, in whole humility, what we want to achieve. Maybe Alison can complement, of course.
Yeah, I think the thing is, lots of the work that's been done with people with disabilities shows that they want exactly the same as everybody else. They want straight, white teeth. They want confidence when they smile. They want to be able to eat a healthy diet. They don't want to feel embarrassed about their mouth. So I think that that's a universal standard of healthcare that everybody should be able to achieve. That's minimum, because that's about well-being, that's about quality of life, that's about self-esteem, that's about relationships. It's about everything that we know holistically is included by having good oral health, systemic impacts, and that should be for everybody. And the fact is, there's a diverse population, and we need to develop a problem-solving attitude to how we address. This happens in cancer care, it happens in every type of care, that people need personalised programs. And medicine's moved forward, so dentistry needs to move forward to show that everybody needs a personalised approach to how they are going to use products that are everyday. And if they can't provide themselves with that care, what help do they need, what innovation needs to be there so that they can actually be independent, because we know that people who independently can provide their oral health, their own oral health, do better, have better outcomes. So all of the innovation, all of the research, along with the education, can mean people can have equal access. We may not choose, but I think that this means we are not at the outset saying only a subset of the population that fit into, the kind of typical range within the whole range of population within the ICF function, that it means that we're not making oral health exclusive, we're making it inclusive.
You were just saying how it's important for this to kind of be tackled from the onset of somebody's dental journey, basically, that it needs to be integrated from the beginning.
Yeah.
With that in mind, what can people actually expect to see from this collaboration? What can the profession, what changes will take place within the profession?
Well, I think that the changes that I hope will take part in the profession is that people will start thinking about this. The research that has been done has shown that 80% of people can be provided with oral health care by a general dental practitioner, 80% of them, using just small reasonable adjustments. So what I would hope from this partnership is that Oral-B would help us get the message to general dentists of the small things that they can do, of the disability positive attitudes that they can encourage in their practices using checklists. I think resources, tips and tricks, resources that a practice can use to prepare somebody with autism for their first visit to their practice in advance. I think that small things that can educate on things that can help with the right language to be using, because people who aren't used to disabilities sometimes aren't familiar with how to actually use the language, and they feel uncomfortable. And I think we need to give people the courage, and we need to give them the training. And the sad thing is that they've often gone through dental school and they haven't had people with disability in their own family, so that they're very, very uncomfortable with people with disabilities. And yet very small changes, and actually working with the person with disability, ask them in what they need, and working together. This is a partnership not only between Oral-B and IODH. This is hopefully that we're encouraging patients and dentists to partner together to problem solve, and communication is at the key to that. So I think lots of dentists qualified without any training. We can address undergraduate training, and we can campaign and advocate together for dentistry to be taught to new dentists. But we can also give tips and tricks and show dentists that Oral-B expects that that people with disabilities are going to be within their patient mix, because there's so many people with disabilities that we know that they should be being seen by a generalist. So I think if Oral-B shows that it's expecting and it's not abnormal to be talking about disability, it's something that is inclusive, and that oral health is for everybody. So I think that was what I would hope to come out: shared messages, but practical help, and showing people that it's not rocket science. It's about sharing information, and then little by little changing a mindset.
I think that's a good point. I think it's giving people the confidence, isn't it, to use the right language. I think there's a lot of people can be quite unsure about how to talk to people perhaps with a disability, or what words are, and I think it's giving people the tools and equipping them with the right language so that they feel confident in approaching
You
that.
see in the Paralympics with the archery competitions or the swimming that people can achieve huge, great big, can run faster than I can certainly achieve so many goals, that surely toothbrushing should be within the scope of everybody. But I think language is really, really important, because that's a power balance. That shows respect to people with disabilities. People with disabilities need to be respected, and their needs and wishes need to be respected, and language is at the heart of that.
Yeah, and on our side, I mean, a lot has been said by Alison, so we are after a very sustainable partnership here. I think, by the way, Oral-B and IADH, we share the same values on what we want to improve and do with people, for people with disabilities. And on my side, what I would like to achieve really is deliver on, let's say, steps. So one of the first steps is probably to work together with the IADH to co-create a positive practices training program. We were talking a lot about, let's say, dentist professional, and this program would be designed to train and educate dental practices on how to become more confident and inclusive when it comes to their patients. Because of course we meet a lot with them, and we have certainly a lot to do to progress in that area. So that's one of the first steps we want to tackle all together.
Perfect. No, that's great. Thank you. I mean, the last question I think we kind of answered that. What can the profession expect in the future? I feel like we've kind of incorporated that as well, unless you both feel like there's something else that you'd like to add or that we've missed.
No, I think we said it all. So for us, very excited. We want to make the difference in that area. And I believe the partnership with IADH will be a big catalyzer, a big fueler to accelerate.
Definitely. I don't think there's not much of anyone else doing what you guys are now doing. I think it's really important to talk about it. I mean, particularly we ran a couple of articles in July, as it was Disability Pride Month, talking about not only how to approach patients who may have a disability, but also working with dental professionals who may also have one, particularly if it isn't visible. So we're really trying to kind of push that conversation as well. So it'd be really good to, any lecturers or anyone you feel particularly stands out, please let us know, and we'd love to have an interview with them as well and kind of push out some more articles.
I think that would be wonderful. I think that the underlying, we are so excited about this partnership because I think there are endless possibilities. But I think most important is that it's something sustainable. But I think that we can't deny that disability is everywhere.
Yep.
And so we can't ignore it for any longer. And that's what I'm most delighted at, is that Oral-B is not ignoring this problem. Thank you.
Yeah.
Thank you.
For sure.